Hello, and welcome everyone. Hi there. Hi. Welcome to this Friday's Q&A. I hope you're getting your questions ready. I've had a fair few questions in advance this week, so I will answer those too. But before I do start answering people's questions, if you could let me know that you can hear me and see me loud and clear, that would be lovely. I would be super grateful if you could just let me know in the comments. You just write a little comment saying, we can hear you loud and clear. That would be brilliant. And while you're doing that, I'm going to introduce myself. My name is Lucy Macdonald. I am a physiotherapist. I've been a physio for 20 years. On our website, on the Octopus Clinic website, you'll find loads and loads of information about preventing injuries, training. Good afternoon, Alan. How lovely of you to join us again. That's super. I will crack on and answer people's questions sooner rather than later. But anyone who's currently watching this, please do start writing your messages. But yeah, anyway, I was introducing myself. So you can check out loads and loads of free information about injuries and training, how to prevent injuries, exercise. We've got a whole library of exercise videos on there, and tons of exercise advice. So things like knee pain, back pain, recovery from long COVID, you name it. So good. Glad to hear that you can hear us up in Norfolk. That's a really fun way to start off, actually. How far north can we go, whether it's in the UK or beyond? And then I'm in London, UK at the moment, so it'd be lovely to hear where everyone's tuning in from, because I'm sure I can see people are joining slowly but surely, but it'd be lovely to get some idea of how far our little community, our little Friday Q&A community is spreading nowadays. So I am a fan of Norfolk. Went there last summer. It was fabulous. If anyone wants to get in touch, you can see on the screen at the moment, you can see our contact details, reception at Octopus Clinic, or you can just go through the website and all the information is obviously on there. I predominantly do video consult, Doncaster, lovely. Kent, South Carolina, fabulous. Oh, how lovely. So in fact, I might even just show. What happens if I do that? Oh, it looks a bit crazy, doesn't it? No, let's not do that. I was going to try and show the comments as they come up, but I'll just click on them one by one. So yeah, please do just go onto the website and you can get all the information that you need on there. Right. South Carolina, how fab. Okie doke. Let's start with, so those of you who are watching live, if you could just start letting me know any questions that you have today on pain, injury, training, recovery from long COVID, you name it, please do start asking your questions. And in the meantime, I'm going to ask some of the fabulous questions that people have asked me in advance. So the first one is about knees. So the question is, I had an arthroscopy yesterday, a meniscus repair and arthritis clean out. What are the best exercises to build strength? I have decent treadmill and an exercise bike and a good selection of free weights, kettlebells and wrist ankle weights. Well, that's brilliant. You sound like you've got a home gym, which is rather fabulous. So the answer is that an arthroscopy, for those of you that don't know, is keyhole surgery. So and the meniscus, the fact that you've had a meniscus repair is really, really important for me to know, because the menisci, so the menisci is just the plural of meniscus. So you've got two of them that sit on the bottom of your knee joint here. So this is the knee joint inside here. And then you've got cartilage over this bit. And then these blue things, no idea why they're blue. They're obviously not blue in your body, unless you're an avatar. That they are more vulnerable to recovery. They don't have a great recovery rate because they don't have much blood supply. So you do have to be really careful with them. Now, I would like to think that you had been given some advice on from the physios or the consultants that you have seen. So whatever they have told you overrides anything that I'm about to say, obviously, because they actually know exactly what has been going on. But with a meniscus repair particularly, I would be very careful of knee flexion. So in other words, bending your knee more than about 80 degrees. And this goes for anyone who's watching this who's got meniscal problems. Early days, you need to be very, very careful with that, with going beyond about 80 degrees knee bend. So those sort of deep squatting motions. The reason being is that one of the amazing things that the menisci do is when you get to about 80, 90 degrees, the menisci start to shift off the back of the knee and follow the knee through that range of motion, which is brilliant, but it means that they're much more vulnerable through that range. So I would be very careful, first of all, of doing anything that takes your knee beyond about 80 degrees. Obviously, long term, that's what you're going to be needing to do, but I would certainly do that under the guidance of a physio. So in the meantime, what you can do is some nice, presuming that they haven't done any microfracturing, which is when they tap away at the bone to try and stimulate some cartilage or some pseudo cartilage response. But presuming they haven't done that, then you can be doing things like squats. And I would start with a squat. So the thing about a squat is it's brilliant for people at any kind of level of their strength training process, because even if you are only able at the moment to do a little bit of a squat, so just a very small little knee bend, standing on both legs and straightening, and that's within your pain-free zone, because you need to be staying, unless you're doing it under the guidance of a physio, as in one-to-one, not on a Q&A session, unless your physio is telling you that you can push into pain, I would absolutely 100% recommend that you stay well within your pain-free range at the moment. But that might mean that, as I say, you can start with a little bit of knee bend and straightening, just doing some squats with some really nice alignment. So go and have a look on the website, and there's a video that talks through the alignment for mini squats. That's what I want you to start with, as I say, presuming it's pain-free. And that then looks at making sure that you don't get any secondary issues with the kneecap, because with an arthroscopy, you can get a bit of swelling or any kind of arthritic changes inside the knee. You can get a bit of swelling, which then alters the function of the kneecap. So quite often people are left not actually with problems inside the knee, but actually more issues with the kneecap if you don't get that loading right. So squats are great because they train your quads muscles, both concentrically and eccentrically. Both of those types of muscle contraction are super important, whatever you're strengthening for, whatever the purpose is that you're strengthening for. So I would always start with a squat, but you also want to be training your hamstring muscles. And again, you want to be doing it eccentrically, in other words, lengthening your hamstrings. So doing things like a modified deadlift, that sort of thing. I say modified because, again, you want to be very careful that you're not overloading it early days and undoing all that fabulous work that you've had done in surgery. So I would really recommend that you do see someone. So I would recommend that you see a physio. I'm happy to see you by video consultation. There's no reason why I can't look at your movement, look at your knee, and get you going with some exercises. Either me or one of my team could do that by video consult. But I would certainly recommend that, because then I can find out a bit more about the extent of the damage and the kind of things that, I mean, if you've got a treadmill at home, I'm guessing you're a runner. So there's no reason why you can't get back to running, dependent on the degree of the meniscal damage and the arthritis. But certainly very recently I did a video on knee arthritis that I would recommend that you watch. I interviewed one of my previous patients who was given the diagnosis of arthritis, told that she that she just had to be on the waiting list for a knee replacement. And after a few weeks of her progressing through various exercises, she's now running around the garden in her late 70s. So she's back to doing loops of her garden, which is fabulous. So there's no reason why, just because you've been told that you've got arthritis, it doesn't mean that you're going to sort of deteriorate down to a much lower level of activity, as long as you get the strength in place. Okay, so Let me know any questions that are coming in from South Carolina or Kent or Norfolk. Do let me know as you're watching this live. I can see there's a fair few people that have joined us. But in the meantime, I'll continue to answer the questions that I've been asked in advance. So is Bobby watching right now? Because Bobby, if you're watching, I don't have your question written down here. I do have a recollection that it was your hamstring tendinopathy, but if you could write down your question if you are watching, that would be super. I only know the numbers of people that are watching on my screen, not actually who's watching. So, oh, hi, Leanne. Hi. Okay, so the next question is, I have had a niggle in my hamstring for about 4 months now. It's only sore towards the end of a long run or when I'm pushing the speed work. When I first ever felt it, I stopped immediately. I also rested for a couple of weeks. If anything, it's getting worse, not better, but it settles very quickly and doesn't reappear until I am deep into another run. It's not a severe pain at all, but I'm worried that one day it's going to go twang. Any thoughts? Yeah, lots of thoughts on that one, pinging around my brain as I was reading it. First things first, pain around the hamstring. So for just to clarify what we're talking about here, so we're talking about pain in the back of the thigh. The hamstring muscles are a group of muscles that sit on the back of the thigh. And when you're doing speed work, running, you use your hamstrings a lot more than if you're just going at a nice steady pace. So that isn't hugely surprising. And the trouble is, what can happen is that people can get hamstring damage if they suddenly increase their pace, or, I've seen it plenty of times before when people bump into a friend and get a bit competitive and sprint home. So it's always really important to recognize that fast running and slow running use slightly different muscles. So when you're transitioning from slow running to fast running, you do need to do it nice and steadily, like you did when you took up running in the first instance. You need to do the same with speed running. So you need to just think of it as almost a different sport and kind of address it in that way. So you start with increasing your speed slowly increasing your speed in small increments. So for a short period of time, a small increase in your speed, and then build either your time at that speed or the speed itself. That makes sense? So you're only ever increasing one thing. So making it a bit scientific. So it sounds to me like, it is likely, the most likely diagnosis is a hamstring damage, so muscular damage. And the answer to treating any kind of muscular damage is to make sure that you re-strengthen that muscle, because when you get muscle damage, it's not like the muscle fibers. So some of the muscle fibers tear. It's not, what have I got attached to my, So the muscle fibers tear. It's not like those muscles those fibers then heal. Those kind of dead ends of the muscles, if you will, don't reattach. What does happen is the muscle will regrow, and you can get back just as much strength, more strength. There's no limit to it. So, but it is really important that you do strengthen the muscles. So both concentrically, which is shortening of the muscle, and eccentrically, which is lengthening the muscle. So doing things like the waiter's bow exercise to lengthen the hamstring actively, and then exercises like taking your heel to your bum, which shortens the muscle. But it is worth bearing in mind that with runners, unfortunately, stress fractures can refer to that part of the body, so particularly further up, but certainly anything around the hip. In runners, we need to always be thinking we need to rule out stress fractures, because if we miss a stress fracture, it can be life-threatening, frankly. So it's not something that I would run through the pain. I would always make sure that if you do have hip pain running, that you absolutely get it checked out, and I'd be happy to do that by video consult, either me or my team. So do get in touch. So the other thing about hamstring problems that aren't going away is that there's a big old nerve that runs down the back of the hamstring called your sciatic nerve. Now, often, and also it's an area that really commonly refers from the back or the hip joint. So it's a super common area. So the sciatic nerve comes, let me show you here. The sciatic nerve comes out at multiple levels in the low back here, joins into the buttock, and then runs down the back of the hamstring, and then splits and goes to various places. So if you have any irritation of the nerves in here because of either a disc bulge or a bit of wear and tear, all of which are treatable with physio, let me just reassure you on that one. You can manifest, the pain can manifest down in the hamstring. So you don't necessarily get back pain, but it can manifest in the hamstring. So for tricky hamstring issues that aren't going away, we always need to run a couple of tests just to see if there's any of that, any nerve involvement, and therefore treat that component of what's going on as well. I think I had quite a similar question from someone else. So I might come on to it in a minute because I can see there are people asking live questions. So let me have a look at my questions over here that are coming through live. Right, here we are. So Katie, thanks for asking your question. Achilles tendinopathy. What is fabulous is that you've used the correct terminology. I mean, that has just made my Friday. So I'll explain why that is in a minute. I've tried everything not to be able to return to running for over a year. That is a long time. Physio, eccentric loading, soft tissue physio, cycling, and still suffering every day. Now, Katie, just to reassure you, this is something that I see really, really commonly, and I'm really pleased that you've come and you've asked this question because there are lots of things that I can advise. So, anyone who's suffering from tendon problems, I think you might find the answer to this question quite useful. Whether it's your Achilles tendon or your patella tendon or your hamstrings tendon, which reference to the previous question could also be a cause of this hamstring pain. It could be coming from the tendon. But anyway, your Achilles tendon. So for those that, let me grab the foot. So for those that don't know what we're talking about, I'm sure most people know where the Achilles tendon is, but your calf muscles come down the back of your calf, turn into a tendon, and then insert into your heel there. Now, Katie, it would be really useful to know if you could tell me which part of your tendon is sore. Is it right by the bone? So if you poke on the bone, is that where it's sore? Or is it in the middle of the tendon in what we call a mid-portion tendinopathy? I guess the reason that you call it a tendinopathy is because you've seen physios who've told you it's a tendinopathy. The reason that that's important is that, for those that don't know, is that we used to call it a tendinitis. Itis means inflammation of, and we now know that it's not an inflammatory condition, which is why the usual inflammatory treatments like resting it, icing it, elevating, they don't do the job. So what you do have to do is loading it. Now, we used to think that eccentric loading, which is the slowly lowering the heel off the edge of the step, that's the kind of classic symptom. So that's really good news, Katie, that it's the middle of your tendon. That's really, really good news because they've got much, much better prognosis than pain in the heel. Having said that, if anyone's watching this who does have pain in the heel, it's entirely possible to get better. It just takes a lot longer and you have to be much more gentle in the increments that you increase the load. So let me highlight your question, Katie, so everyone can see it. She says, having lost the cursor, there it is. Okay. So yes, we used to think that just eccentric loading, which I presume what you've been doing is doing heel drops off the edge of the step. We used to think that that was what would help a tendon to recover. So we used to think that that would help change the structure of the tendon back to its normal pain-free state. What we now know is that it's important to load the tendon in whatever way, or train the tendon to tolerate load in whatever way you need it to. So in your case, for running, you need to be able to put load through that tendon both eccentrically and, really importantly, concentrically. So the concentric part of the movement is where, as you push up through your foot to go up onto your tiptoes. And then the eccentric component is as you lower your heel down. So I would say the first thing that jumps out at me in what you've just described is that you need to be doing a loading program that involves both eccentric and concentric loading. The second thing that I often see is that people aren't training the tendon through its full available range. So what I mean by that is it's really important that you go through that full range of motion. and that also that you get enough load going through it. Quite often, for whatever reason, the tendon has just not been loaded as much as it should. So I'm not sure whether you've been using a rucksack with weights in your rucksack and really getting that tendon properly worked, because that has much better results than just gently doing it. You also need to be doing them every day, and you need to be doing decent numbers of reps. Now, the research is a bit absurd. The research has been done on around about 120 or more repetitions, which I think is ridiculous. But anyway, I've seen both in having seen tons and tons of Achilles tendinopathies, often that people have had for a hell of a long time. Really positive results with sort of 30 repetitions. So as long as you're getting your 30 reps in every day, chances are, and you're loading it with enough, as I say, weights in rucksack, etc., then I've seen really, really awesome results. But last but not least, it's the speed as well, because if you think about it, depending on what kind of running you do, you don't mention whether you're long distance or sprinting, but you need to be training that tendon to cope with the load at whatever speed you normally run at. Okay, so it's all about starting at that low level and building. Now, things like soft muscle tissue physio, I presume you mean sort of massage of the structures around it, maybe some mobilization. That can give short-term relief, but it's not going to sort the problem out long-term. Likewise, things like acupuncture, all of those things have their place because they can be helpful to give us a reduction in pain, and then you can crack on with the exercises, which is the thing that's going to make the difference long-term. Great that you're keeping up your cardiovascular fitness with cycling. Now, one massive area that I haven't touched on yet, and this goes for anyone watching this, irrespective of whether you have a tendon injury or any kind of injury, is that we then need to work out why is it that tendon of yours is being overloaded. So is there something going on in the biomechanical chain? Oh, that's very physio-y words, isn't it? Sorry. Is there anything going on in terms of your alignment in your knee, in your foot, in your hip, that we could just make a little bit of a tweak to then reduce the amount of strain or going through that Achilles tendon? So it sounds to me, Katie, that so even walking seems to trigger it. Yeah. So there's no point if walking, and when you say trigger it, I'm not sure whether you mean, it sounds like if you say the words trigger it off, that sounds to me like that's quite a significant reaction if you're getting that kind of reaction walking on it. So I'd really love to see you. I'd love to do a second opinion, or maybe even a third from the looks of it. We set a baseline, work out all the different elements of your life that you're loading it. So, for example, I don't know what your job is, but if you are on your feet at work, then we'd need to look at incorporating that component in. Also, don't underestimate the power of all of the different usual recovery. If anyone's come and join me for this before, all the usual recovery things. So decent nutrition, decent stress management and sleep. Those things have a huge impact. There are other things out of our control that affect tendons, like, for example, hormones. But obviously we can't do anything. Well, we can. So, but the more obvious things are nutrition and sleep. So do get in touch, Katie. It would be a pleasure to see you. Okay, next question. Let's have a look. Any tips for injury prevention for gymnastic work? That's a massive question, but yes. And actually, I'm going to answer it in a more generic term, if I may, in that the most important thing is to, whenever, with any activity, with any exercise, with any sport, with any form of exercise, it's really important to build things up in small increments. And if you can build things up in small increments. Your body will respond. You'll get this amazing cycle taking place where your body, in response to the slight increase in load, creates more cells, bigger cells, stronger cells. And that process takes place in everything from your muscles, your heart, your lungs, your tendons. So as long as you do that in small increments, your body will just progressively get stronger, more flexible, etc. If, however, you suddenly increase the amount of movement you're doing or weight that you're putting through your body, the forces that you put through your body, you'll get excessive damage occurring. So instead of just a micro trauma, you'll get excessive damage occurring, and then you'll feel a lot of pain, and you'll be able to you'll have to really reduce your activity levels. And then if you go through that boom bust cycle, you'll end up in a cycle of pain, weakness, etc., rather than the other fabulous adaptation process that I described at the beginning. The other really, really important thing, and I've touched on it already, and no doubt I'll stick on the same record because any of you that have joined me in the past know that I'm really passionate about this, is that if you want that amazing adaptation and repair process to take place, you've got to put the ingredients in. So I've already mentioned time is one of them. But also you need to be putting in all the ingredients for that healing. So a lot of people will focus a lot on protein or carbohydrates. It's super key to look at your good fats and all of the fruit and veg that provide the huge array of nutrients out there. So don't forget to get those in as well. And then absolutely not last but not least is the sleep element. I can't emphasize enough how important sleep is to prevent injury. So hopefully that's answered your question. If not, please do ask me for more specifics in the chat. Bobby, here you are. It's really good to see you. I know that you've been trying to join me for the last couple of weeks, so it's really fabulous to have you. So welcome. When you sent this question to me after I finished last week, I really wanted to have this conversation with you, because it's really strange that you are out for 3 to 6 months with a tendinopathy. Most tendinopathies respond well to some degree of load. And I'm not sure, Bobby, if you've been watching from the beginning, but basically a tendinopathy is not something that will respond well to just rest, ice, the usual sorts of things, the inflammatory conditions. So that's why we used to call tendinopathies tendinitis, and because itis is inflammation. So we know that tendons don't respond well to rest. They don't respond well to stretching. And actually, that's something that I didn't touch on with you, Katie. If you're still watching, please don't do loads of calf stretching for your Achilles, in the same way, Bobby, that I would advise you against doing hamstring stretches, because we think that could actually make it worse, but certainly won't make it any better. I'm not sure what else you've been advised to do, but my plan with a hamstring tendinopathy would involve loading the hamstring statically to start with, to try and give you some pain relief, because we know that static loading of tendons can be really brilliant at reducing pain. We then add a little bit of movement. So we do an exercise, for example, like and I'll look at this because it's on the website. It's called the waiter's bow exercise, but very slightly start to load that tendon and then progress it in the same way that I've described earlier. So progress it both in terms of range of motion for whatever you're trying to achieve. So, for example, with the previous question about gymnastics, you're obviously going to need to work that hamstring into much, much bigger ranges of motion than if you're a runner, because you need much less motion. So with a runner, you're going to be more focused early on loading it. So actually using weights to load that tendon progressively, and then build up speed as well. But it's important to note that it's not a matter of doing statics, then movement, then weights, then speed. You've got to keep those other earlier components running through it throughout the program. We know that the recovery for a tendinopathy is 3 to 6 months, but minimum, but depending on which tendon and how long it takes. However, that doesn't mean that in that time you should be out from running entirely. So I would expect, I don't know, I don't have a full history with you, but if you have other medical history, so say you've got other previous, if say you're a diabetic, or you've got other health issues going on, it might be that your recovery processes are slower. It doesn't mean that it's going to be impossible, but it just means that, as I say, you're going to need to build those that load in smaller increments. But yeah, it does strike me that is a long time to be out. I would want you to be loading it now. The only exception to that would be if you've got a fracture of where the hamstring inserts into the ischial tuberosity. So your hamstrings insert into here, into these bones at the back here, the bony bits of your bum, if you wiggle your bum around on a seat. So if you've got a fracture there, then yeah, you're going to have to rest it. But if it's a straightforward tendinopathy, then I hope that's given you hope, Bobby. Please do ask me any other specific questions based on what I've said to you so far. Yeah, and that's super common, that sitting in the car can be really aggravating. Can you let me know, Bobby, if you get the pain when you say down your leg? Do you mean just down your hamstrings to your knee, or do you mean beyond that? Because if you're getting pain beyond that, then I'd be wanting to think about looking at whether there's a component coming from your back, because it'd be unusual for your hamstring tendon to be referring that far down your leg. And that might also explain the slow recovery. But yeah, let me know how far down your leg it goes. So when you're sitting, because depending on your car, obviously, but when you're sitting, you're going to be sitting right smack bang on the hamstring tendon. So I would recommend, if you have to when you have to sit down, like when you're driving, that you're kind of creative with pillows to just try and take the pressure off your bum, or that part of your buttock. So you can get things that are often, if you look up the kind of rings that women often use post-birth, that take the pressure off take the pressure off the middle of the buttock, the middle of the groin. You can use those. You could get a couple and sit on them so that you've got less pressure going through your bum. So you do want to be avoiding sitting on it, because it will just aggravate. Okay. So interesting that you're doing bridges and you're doing resistance bands. They're great, and that is a way of loading your hamstring, so that's a good start. But I would also make sure that you're doing things functionally. So the way that your hamstrings work are both, as I mentioned, concentric and eccentric. So you need to be doing both components. So things like a modified deadlift or a Romanian deadlift, the kind of exercise that I've mentioned already, they will be much more effective and more specific to the way that you're wanting to use your hamstrings, as well as doing things like hamstring slides in a bridging position. It's really, really important to get that balance right. And as I say, it's all about looking at the overall picture of what else you're doing in your day-to-day life, so that we can make sure that we get the balance right. Thanks. Good. So it's just down to your knee. So yeah, it does sound like a classic tendinopathy. So loading Achilles tendinopathy, silly question, but do you mean a rucksack on your back with some weight in it while doing heel drop walking or light running? I wouldn't put a rucksack on your back walking or light running. I would do it with heel drops, but I'm so hesitant because I have to advise you to do it pain-free. Whereas if I can see you for a consultation, then I might change that advice. But it's really important, because I haven't seen you, that anything that you do is pain-free. So that if it's not a tendinopathy, if it's not an Achilles tendinopathy, that we can make sure that you're being safe. But yeah, I meant rucksack with weight, with heel drops, rather than walking or light running, unless you're planning on doing that as part of your, I don't know, if you're in the army, or you're doing that as part of training, you're planning on going on an expedition somewhere, and you need to train yourself to be able to carry rucksacks, then that would be the only time that I would recommend doing that. Okay, next question. My podiatrist suspects, let's move this. I'll move it across when I've read it, because it's hard to read it on the when I ping it across. So Paula, this one's, I'm answering your question. So my podiatrist suspects I have plantar plate tear. I have an ultrasound booked, but in the meantime, what rehab can I do? I'm taping the toe down, and it appears healing has commenced already, as I time out for a stress fracture, as I've had time out for a stress fracture last year. Quite honestly, if you're seeing a podiatrist, Paula, I would follow the advice of your podiatrist, because they've got much more information than I do. It doesn't massively surprise me that if you had a stress fracture and then you return, unfortunately, the plantar fascia, even though it's not technically a tendon, it behaves a bit like a tendon. So we know that instead of doing the usual sort of icing it, blah, 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 icing it, resting it, etc., we know that it responds to loading. However, depending on the extent of the tear will hugely depend on how much you're able to load it, and at what point in the process. So I would email your podiatrist and just say that, you know, what are you supposed to be doing from a loading perspective, because you understand that would be a good thing to introduce at some point, but that you would like to have some specific guidance on that. I think that would be sensible, and whatever you do, when you do return to loading it, just do it in small increments. Did I mention that? I think I might have mentioned that. Let me know how you get on though, Paula. So, right, next question. This is related to the gymnastics question again. So, injury prevention exercises that can help with hips. We do a lot of pelvic tilts. So how can we make sure we warm up the hips properly and reduce strain through the hips? So with regard to, I just seen a message from a friend who's a podiatrist. Yay for podiatry! Dave James. That's brilliant. Yes, so right, so back to the hip mobility. I would strongly recommend that you warm up using dynamic stretching. So we now know, and this is for everybody watching, please don't do static stretches before you exercise. We now know that static stretching is certainly not advantageous before or during exercise, and actually we suspect that it might actually potentially increase the risk of injury. So please don't static stretch as part of your warm-up. It is, however, appropriate at the end of your training session while your body's still warm. So in this case, how do you warm up properly? Well, you do loads of dynamic stretching, and by that, dynamic stretching looks nothing like a static stretch. So I think it's an incredibly confusing word, but that is the word for it. What it looks like, if you think about the last time you saw a professional athlete just about to hit the gym mat or the pitch or whatever, you'll remember that they do repetitive movements, starting with a small range of motion and then building up that range of motion more and more and more. So they swing their legs around, flail their arms around, etc., etc. That in effect is dynamic stretching. On the website, we have a whole section on dynamic stretching. If you go on there and you have a little look at all the different videos we've got, you'll see one on hips, and you can loosen up your hips that way. So hopefully that's helpful. Interesting question from Katie, which I'm going to confess, I don't know the specific answer to it. I'm going to go and find out. Why is stiffness so bad in the morning from an Achilles tendinopathy, or all tendinopathies. So one of the things that a diagnostic factor when we're thinking about tendinopathies as clinicians is that morning stiffness is always worse in the morning. So tendon problems are always worse in the morning. Physiologically, it'll be due to something to do with the inflammatory process being at its highest at night. Now, inflammation is part of healing. In the middle of the night, in the early hours basically of the morning, our body's cortisol level, so our natural anti-inflammatories, drop to enable that inflammation to take place. So because, as I say, inflammation is the first stage of healing. So in the night that peaks. Now, why then that leaves you with stiffness first thing in the morning? That is a very good question. I will go away, speak to some of my physiology gurus and come back to you. That's an awesome question. On a kind of useful, kind of practical note, it is one of the last things to get better. So don't worry if every other aspect is improving, but that stiffness is just being a bit stubborn. That tends to be one of the last things to fully resolve. So as long as everything else is steadily improving, when you wake up in the morning, it's a great time to do some of that loading. So start to, put your feet in some decent trainers and do some of your eccentric, concentric loading exercises. And then that should feel a lot better for the rest of the day. Okie doke. Right, lots of fabulous questions today. This is great. Please do keep them coming. Let me know if you have any questions, pain, injury, recovery, and I will continue to answer them. So my next question that I had in advance, let's see if there's any links to any of the things. Let me just have a little look at my list and have a little swig of... Oh, thanks for that, Dave. There you go. While I'm looking at my list, you can read Dave's response. Dave's a podiatrist, super fab podiatrist at that. And on that, if in terms of foot level stuff, as Dave calls it, if you go onto the website, octopusclinic.com, and you go to the foot and ankle section, you'll see some various different exercises. I'm not going to put up the response to what I'm about to say from Dave because he's probably not going to be very impressed with this. But say, for example, you've got a particularly stiff foot with quite high arches. You might need to work on pronation, which is a totally normal part of the walking and running cycle, but it gets a bit of a bad name. But pronation is really normal. So if you've got quite a rigid foot, then it might be worth you looking at those exercises. If you, however, have got quite a flat foot, so a foot that has a not much of an arch, then you might want to do the exercise on there where you've got a band around your ankles and you're working on creating those arches. And then there's another exercise, which I always remember the number of for some weird reason, exercise 42, where if both types of foot would be good to work those, to make sure that you're working the stability muscles of the foot and ankle, as well as just loading those calf muscles and Achilles. Okay, what's this say? Are bursas common with Achilles tendonitis? So bursas are all over the body and they sit underneath tendons. So a bursa is a normal anatomical structure. Alongside having a tendinopathy, which we used to call tendonitis, alongside having pain in the tendon, often it comes with an inflamed bursa. So the classic one is the hip. So the gluteus medius tendinopathy has a bursa that sits under it that often people, because it's quite close to the surface, like to squirt a bit of steroid in to reduce down the inflammation. But normally, if you treat the tendinopathy, then you also, as a side note, treat the bursa, the inflamed bursa, at the same time. So, for example, with an Achilles tendinopathy, if you make sure that you're not stretching the Achilles loads, then you're not going to be squashing and inflaming that bursa quite as much. And as long as you're making sure that you're building in increments, then you won't flare up that bursa, and eventually that bursa will settle down. So there we go. Dave, that is just, you know. Right, okay, next question. I'm going to try and find another one about the foot while you're still watching, Dave. So let's have a look. Right, I'm going to answer this question, actually. I can't find any more about feet, so I'm gonna move on to this question here. Oh no, there's one that's coming through here, and actually I've got quite a lot of oh great, I've got sorry, there's a bit of I've got all these messages pinging up at the side, and there's some clinicians that are misbehaving, so sorry about my silly giggles in the background. I'm not giggling at your injuries, I'm giggling at their silliness. So here's a question. I've noticed that for a few days after long runs, I get dull aches where my legs attach to the pelvis, both legs and on the inside groin and the outside of the pelvis. Stretching it out feels amazing and temporarily eases it, but is there anything I can do to prevent or reduce this? So yes, Dave, this is the thing about stretching, is that it feels really, really good. So that's why we all instinctively do it. And for some reason, stretching has got this disproportionate level of responsibility to get us all better. And unfortunately, the literature, the current medical literature just doesn't back it up. So although it feels nice, there are better things that you can be doing. Now, there are a couple of things that hit me straight up. And the first one is the fact that you're getting the pain on both sides, and particularly in the groin. I'm not sure what you mean by the outside of the pelvis. Do you mean sort of around the hips, or? But if it's both legs and on the inside of the groin, there's a possibility that there's something going on with this joint at the front here, which is called your pubic symphysis. And you've got lots of muscles that insert into this part of your body. So I would recommend that with this kind of injury, Dave, that you do need to get it checked out. So we can do that, as I say, by video consultation. But I do think that, mind you, you've only had it for a few days. So probably if you've just had it for a few days, you could just see if you can make some adjustments to your training to improve your recovery, and maybe reel in the running a little bit and just focus a bit more on your strength conditioning and see if that does the job. So I would spend all that time that you spend stretching, I would replace it with focusing on recovery things like making sure that you're looking at your nutrition and relaxation. And I would also then maybe look at how much you've increased your running recently. Maybe you can answer that question, actually, Dave. Have you increased your running significantly, or have you changed it in some way? So have you suddenly introduced a route that involves more hills, or have you started running with a mate that runs a bit faster than you, or something like that? So is there a sudden increase in load? Because if that's the case, then your best bet, and certainly the way to sort of self-manage it, is to just reduce back that load a bit, replace it with some strength. So say, for example, you are trying to increase your speed running. That's perfectly reasonable, but it is important to make sure you've got the strength in order to do that. So I would reel back your running, increase the amount of strength and conditioning. And if you're not sure what I'm banging on about when I talk about strength and conditioning, go onto the website and put in best exercises for runners, and you'll see on there I cover the best strength conditioning exercises, the best alignment exercises, and the best stretching exercises. So for any runner that's watching this, please do go and watch that video. That's a no-brainer. And then the other video that you need to watch is the how I can improve my recovery video. So again, just stick the word recovery in the website and that will ping up, and I talk through lots of really useful practical tips that you can use to improve those things. So beyond that kind of general advice, if you're getting issues around the inner part of your groin and then also the outer parts of your pelvis, so you've responded to my question saying yes, the outside of your hips, then it strikes me that you obviously want to be working particularly on the strength of those of your glutes muscles. So the majority of the power to propel you forward comes from your glutes muscles. So but they will only work if you've got, or they will work optimally if your pelvis is in the right position. So what I would recommend that you do is you check out the Running Man exercise that talks about the pelvic position. One of the things that I noticed is really common in runners, and I don't know, Paul or Dave, any other clinicians that are watching this, whether you'd agree, but one of the things is, particularly with people with hip or groin pain, is that they tend to tuck their bottoms under. And actually, if you change that pelvic position to very slightly sticking the tailbone out a bit, it can really have a very immediate effect on reducing your pain. So I would make sure that you're not tucking your bum under. If you're not sure what position your bum should be in, I'm going to have to demonstrate this, aren't I? If you tuck your bum under as far as you can, stick your bum out as far as you can, and then go to the halfway point, 50% of the way between the two, that's your neutral. Now, everyone's neutral is different, but you just want to be in that mid-range. And then all the muscles and tendons and joints will work more optimally than being at their end of range motion. I'm going to demonstrate it. So can you see? I don't know if you can see this angle, but anyway, so you want to stick your bum out as far as you can, tuck your bum under as far as you can, and then go halfway between the two. So you still want to always have a bit of a curve on your lower back, because your lower back is designed to have that little curve. It's not designed to be completely straight. I think the reason that people, coming back to that, why people tuck their bum under, I think it's because lots of people know that the glutes are really important. When we contract our glutes, we tuck our bottoms under. Unfortunately, that creates more problems. So just bear that in mind. If that doesn't work and it's sort of starting to appear, because you can get tendinopathy. So groin pain can be due to, as I say, the joint at the front here. It can refer from your back, it can refer from the hip joint, it can refer from your sacroiliac joint. So there's multiple causes of groin pain. And as I said, stress fractures as well, although it's less likely if you've had it for, you need to reel back your running anyway. What was I going to say? Oh yeah, if it is a tendinopathy, so if it's more on the inside of the groin, then it could be your adductor tendons. If it's more the front of the groin, it could be your hip flexor tendons. And certainly if it's pain over the outside of your hip, it could be, so particularly over this bony bit of the outside of the hip here, then it could be your gluteus medius tendon. It could be a gluteus medius tendinopathy, and all those things need obviously different loading programs because they're completely different muscles. But let me know. Keep me posted, Dave, and by all means come along next week if the pain is still persisting once you've put those things in place. Right, okay, next question I am going to answer is someone who has sent me a question saying, I've been suffering from coccydynia for a few months now, which is worse after running. It's slowly improving as long as I don't sit too much and do plenty of glute work, but any tips would be helpful. It doesn't hurt when running. So I'm just going to put this, because this was an advanced question. So I'm just going to sort this up. Okay, so in answer to the question about coccydynia, for those of you that don't know what that is, your coccyx is your little tailbone there. All right, so this is your tailbone, and coccydynia is pain in that area, and it can be excruciatingly painful, and particularly because it's always painful when you sit on it. So you're doing absolutely the right thing to try and limit the amount of time that you're actually putting pressure through that part of your body. And when you are sitting on it, there are all sorts of cushions and things that you can sit on to try and take the pressure off, because otherwise it can be unbearable. There are a lot of muscles that attach into that area, and your pelvic floor muscles are key. Now, it's really important to always bear in mind, particularly with coccydynia, that muscles need to contract and they also need to relax. So one of the things that we can do, and I don't know how sort of historically sporty you are or whatever, but I often see it if people are quite sporty and they're used to contracting or trying to focus on strengthening the muscles and improving muscle strength, etc., that can often result in a constantly high level of contraction of, for example, the pelvic floor muscles. So I would recommend that you have a look. It's great that you're looking at your glutes, which is excellent. And I'm really pleased that it's improving. I would also just have a think about whether you're able to contract and relax your pelvic floor muscles, both at the front and the back, obviously at the back, and potentially see a women's health physio. So a lot of people aren't aware that there are women's health and men's health physios that can do internal examinations and help to release, for example, the pelvic floor musculature, which can help to reduce things like coccydynia. But it sounds to me like it's improving, which is great. So I would just think about doing lots of work on relaxation of your buttock muscles and your pelvic floor muscles. So lots of nice breathing exercises, that kind of thing. Lots of focus on sort of low level contractions rather than contracting everything and trying to hold it. So think about that release of your muscles as well as the contraction, and make sure your pelvis is in a decent position. So make sure you're not tucking your bum under too much, or conversely sticking your bum out too much, because that will put more pressure on the soft tissues as well. There are lots of other causes of coccydynia, so I would suggest that if you haven't already seen a specialist, please do get in touch, and I can give you some recommendations for people that specialise in that. So, right. Next question is, what is the best approach for increasing extension flexibility in the lower back? I'm well prepared for it depends. It depends why you want to increase extension flexibility in the lower back. That is, and that isn't to be taken lightly, because quite honestly, if you're a gymnast, increasing extension flexibility, so in other words, bending backwards, is pretty important. However, if you're not, it depends what you're wanting to do it for. So, because the reason that it's so dependent on that is because it will entirely dictate how we go about improving it. But that aside, I would always start with pelvic tilting. So you can do that in sitting, you can do that in standing, you can do that on hands and knees. And by that, what I mean is slowly curving the bottom of your back and then slowly sticking your tailbone out again. And if you go to the website and you look at, maybe just put the words pelvic tilt in the top in the search panel, and you'll see some exercises that will come up. I think there's one sitting on a gym ball, and I talk through improving that extension and flexion motion. So that would be a good starting point. And then, as I say, I'd need to know a little bit more about why you want to extend your back more anyway. So it's an interesting question, because flexibility, in my opinion, is something that people get far too caught up with, when actually strength is far more important. And we also now know that strengthening exercises are the best way to improve flexibility, rather than just straight up static stretching. So but hopefully that might give you an idea of the kind of things that we'd be looking at. So there's another question here about shins. So I get a slight niggle in the first 2 miles. Hang on, is the first 2 miles I ache a fair bit, particularly my shins. I'm putting this down to having had a break from running. Yeah, so just one thing to really pick up on this one. If you've got shin pain when you're running, you really need to slow things down. And that's because depending on where it is on the shin, I'm just trying to look on the floor at my various bones, and I don't have one for the whole of the tibia, which, well, that would be a fun present for this week. Anyway, if the pain is down at the bottom on the inner aspect of the shin, then that's your classic, what we call medial tibial stress syndrome. And if it's pretty early days, then hopefully if you reduce back your running a bit and then build it up more slowly, you should be okay. If it's further up over the bony bit of the front of the shin, a bit higher up, or over that very front of the shin, then you really do need to be careful, because it can develop into a stress fracture front of the shin there, an absolute nightmare. So bring back your running and build it up more slowly than you have previously. Also, with any kind of shin splints, it's really important that you get your calves nice and strong. Loads of people focus on calf flexibility, but we actually know that it's really important to strengthen your calf muscles, and particularly your soleus, which is one of the muscles at the back of the calf there. So make sure you work that into your program, and then looking at your general strength and conditioning. So as tempting as it is when we've had to take some time off, or taken some time off because of lack of motivation or whatever, as tempting as it is to go back at it, to try and get back to the previous level quite quickly, it's really important that we work on our strength and conditioning and sort out our biomechanics, so that then our body is ready and the muscles are ready to take the load that we put through it with running, so that we can then prevent injury. I have recently done a video on shin splints, so if you go onto the website and you put the word shin splints in there, you'll see that video, so please do go and check that one out. I talk through shin pain, shin splints in quite a lot of detail on that one, so please do check it out. Okay, next one. Let's just check to see if anything else has come in live. I've noticed for a few days after long runs that I get dull aches where my legs attack. Oh no, we've done that one. So I originally tore my groin back in 2018, and the pain seemed to resurface about a month ago. I haven't run on it since and have been going with rest method of recovery, but is there anything else I can do to help it? I've looked up some stretches online, but I'm worried I may be making it worse. So if you've watched from the beginning of this, Ashley, you'll know that obviously it depends on which part of your groin you're referring to. So I can't sort of give you specifics because I don't know which muscle or tendon you tore. But it sounds to me like it's the classic case of coming right back to what I was talking about at the beginning, where when you tear a muscle, it's really important to strengthen that muscle up again. Now, sometimes you won't notice that weakness until you then start to push yourself, perhaps with running or whatever exercise you're doing. But it sounds to me like you need to do some strength work of whichever muscle group it is. So whether it's your adductor tendons or your adductor muscles or your hip flexor muscles. And I would make sure, again, so just to recap of what I've said already, make sure that you do it concentrically and eccentrically to make sure that you're building that up. But also I would always have a bit of a flag in my head, again, because it's that hip location. I would always have that little concern in my mind that I'd want to rule out a stress fracture, because it, for example, I'm not sure how it was diagnosed as a tear way back when, but perhaps if there'd been some bony stress then, and then we're sort of being faced with the same kind of bony issue now, but missing that diagnosis. It's very important that I am able to rule that out. So I would just bear that in mind as well. And I've already covered about stretches, so it's all about more looking at your strength and alignment rather than specific stretches. But do join me next week if you can, and give me a little bit more information over which part of your groin is injured, and anything else that may have contributed, that'd be really helpful. So next question. Oh, that's an interesting question. How to cure a firing left glute when running? I stretch before and after every run. Now, Nikki, if you've been watching this from the beginning, you'll know what my first thing is going to be is please don't stretch before running. So stretching, we know certainly does no one any favours if you stretch before or during exercise, and we think that it might even increase your chances of getting injured. Fine to do it at the end, just not before or during. Unless, of course, we're talking dynamic stretching, which we've talked about already. So it's interesting that you say how to cure a firing left glute. Do you mean that your left glute is painful when you're running? And if so, which part of your glute is painful? In our physio mind, left glute firing is a good thing because it means that it's contracting, and glutes are supposed to be contracting when you're running. So if you could just clarify what you mean by that, Nikki, give me a bit more information, that would be really helpful. And while you're typing away, giving me that information, I will answer one of the last pre-sent messages. So yeah, please do fill me in on a bit more information there, Nikki. Okay, so next question was, I hope you're good. I'm good, thank you very much. I've had a pain on the inner side of my lower legs, my calf muscles. I think it's been flaring up when dog walking as she started pulling a lot again. Everyone has dogs at the moment nowadays, don't they? Everyone. And I'm breaking a lot in my legs to pull. Any suggestions other than foam roll? That has brought up a very good topic, which is foam rolling. So foam rolling, although it can give you some nice short-term relief, it's not going to sort the problem out long-term. It depends where in your calf. If you could join me, if you're not, I'm not sure if you're currently watching this, Gillian, but it would be great if you could join live, and then I can ask you a few more questions next time. But if it kind of depends where it is in your calf muscles. So I've done a video on calf muscle pain. So if you go to the website and just put in calf pain runners, you'll get a video that I've done relatively recently. So do go and watch that video. If when you've watched that video you're still like, no, that's not what's going on, there might also be a possibility, if it's that inner side of the calf and possibly sort of round the inner part of your ankle there as well. So if it's sort of the inner, then it could be a muscle called your tibialis posterior. So just have a Google of that and see if that makes any sense. And if that's the case, then we need to do some work on specifically loading that tendon and muscle. But in the meantime, I'm not sure what shoes you're wearing walking, but just make sure that you've got really nice supportive shoes. So perhaps your running shoes when you're taking the dog for a walk, depending on what the surface is like that you're walking, or some nice supportive boots in the interim. Yeah, it's going to be a matter of, because it sounds quite direction change and load with that direction change. So we probably want to be giving you stuff that trains you to get that direction change and that what we call multiplanar. So I'm just chuck a couple of physio things out there. Multiplanar movements and strengthening exercises for the foot and ankle, and then obviously looking further up the chain as well. But very jealous of people that have dogs, because I don't have one and I love dogs. Okay, so next question is, I'm just returning to running after a hip injury, although it's still a constant niggle. It's not got worse now, running again, but getting lower back ache a lot now. I think I've actually already answered this question. So Michelle, if you're watching, I hope that I answered your question very thoroughly throughout this. So if you're getting a bit of lower back and hip ache, it could be two separate things. There could be some backache and some hip or localized issue going on, but it's also very we're increasing our chances of there being the hip pain being a referred pain from the back. But as I say, they often go hand in hand, because as you can see from the model here, your hip joint that sits in here and your back, they're so super close. that that and the mechanics are so interlinked that you can often get both bits being an issue, so either directly or indirectly as a result of each other. Okay, I'm going to have to wrap up soon. It's been a fabulously long session today, so thank you all very much for joining. There were a couple more that squeezed in at the end. Dave, I will. This is a great question though. I can't help myself. Right, let me whiz across and just answer this one. I'm going to answer it really briefly because I do need to wrap up. I have a tendency towards, so this was the question earlier about how do I increase lumbar extension. So my answer to this question, it's really useful that you've given me more information, is that when you say I have a tendency towards flexion due to spina bifida and cycling, plus I get an acute flare up, so which is the pain in the lower back. So do you get your flare-ups from cycling? I just need to know more. Dave, you're going to have to come back next week and you're going to have to tell me what activities aggravate your back pain. And then I can answer your question. So next question. So I'm going to do this question from, no, we did that one. Good. Nikki, did you want to ask me anything else? Because I know I'd asked you for more information on that. Okay, so this is the last question, unless, Nikki, you get back to me. So any idea what a bumpy area on my left knee is? It looks like a cauliflower. The quick answer is, without looking at it, no. And I think if you have a bumpy, lumpy area, you absolutely 100% need to get that seen to. So I would be happy to do that, either me or one of my team. And if you can't do that, then please do go and see your GP and make sure you get any lumps and bumps checked out. No, you're not. You're not broken. I shouldn't have highlighted that one. You're not broken, but what you might need to do is train some of your movement patterns, Dave. Right, okay, so I'm going to swig my tea. Oh, no, actually, I do want to show off something that I did. No one has asked me any questions about knee pain in runners today, or shin pain. And normally I get loads of questions about knee pain and shin pain. As there's only a few of you left watching this, I want to just show off my newfound creative skills. So look at this. I'll be back. So what do we think? So I will, after today, I will do one for hip pain in runners, as that seems to be a super common one. I will do any other suggestions for little videos that you think would be useful. Please let me know and I will do them. But in the meantime, there's loads of videos. Oh, thank you, Alan. I'm glad you like this. Okay, well, if you insist, I'll show you another one. Do you want to see one more? And then I'll stop showing off what I've been doing this week. Okay, ready? I'd totally forgotten that I'd done one on Achilles tendinopathy. So there we go. I should have played that when I was banging on about Achilles tendinopathy, shouldn't I? So let me know what you'd like me to do videos on next week. But do go to the website. You can just use the handy search tool at the top there to stick in whatever topic that you would like, and you can find out loads of information on there. But for those of you who are just joining, please do try and join me next week. I kick off at 30. I've been going on for far too long today, so I am going to need to say goodbye. So apologies for people that are just joining now, but it would be an absolute pleasure to see you, friends, family, 1:30 p.m. every Friday on Facebook, YouTube, Twitter, not Instagram because it didn't work today for some reason. But yeah, please do join me next week. It'll be absolutely lovely to see you then. Take care, everyone. Bye.